Okay, chapter 6 is the osseous tissue or the bone from the mainly histological point of view. And the skeletal system, generally speaking, is the bones, cartilage, ligaments, connective tissue, everything related to the bone, but we will focus more on the actual bone. The function of the skeletal system, generally speaking, is support. We all know that. It's supporting our body. Storage of calcium. So the calcium in the bone can be used in case of if we need it. And when we say we need it, it means the most important thing is the calcium level in the blood. This is the most important thing about the calcium homeostasis. It's all about calcium level in the blood. We need calcium in everything. The bone is what we all know, but actually the more important about the calcium is something like the muscle contraction, specifically the heart. If you don't have enough calcium, the heart will not be able to contract. Death. So it's that severe, which is more important than the bone. So the bone does need calcium to be strong, but it stores calcium if needed. And the bone marrow. The bone marrow, we have two types of bone marrow. The red and the yellow bone marrow. And the color come from the contents. This bone marrow that produce the blood cells is called the red bone marrow. The yellow bone marrow that's later on during lifetime when the lipids start to be stored within the bone marrow and the color change to become yellow. So the yellow is mainly for storage of lipids, and this is later on, not during childhood or something. Of course, it's for protection, something like your reps, your sternum. This is to protect the heart and the lung and so on. It also acts as a leverage, like force of motion, so that you can move your joints and so on. We are going to classify the bone in different ways: shape, organization, the markings, and so on. So the bone can be flat, something like the bones of the skull, if you still remember. Parietal bone, temporal bone, frontal bone, and so on. This is all flat. The second type is the long bone. This is like all the long bone that we learned. The humerus, the ulna, the radius, the femur. This is all anything that has a shaft. And when you say long bone, you don't mean long. Okay? Long doesn't mean long. Long means that it has a shaft and the length is greater than the width. This is what we mean by long bone. It doesn't mean it's actually long. It's if you're comparing the shaft to the diameter. This is where you call it long, and that's why these little bones here, look at this. The bones of your finger, very short, right? It's long bone. Because it's about the shape, not about the length or measurements. So this is the long bone. The next is sutural bone, and from the name, sutural bone means the bones that develop within the suture. Do you remember the suture? Sagittal suture, lambdoid suture, and so on. So any bone that forms within this suture, we call it sutural bones. Patella is called the sesamoid bone, and sesamoid bone means a bone that forms within a ligament. Somehow you have a ligament. If you actually feel it, if you feel your patella and contract, you will notice that this muscle, we didn't do the muscles yet, but this muscle, which is the quadriceps, attached to the patella, and the patella attached to the tibia. Okay? So what's happening here is the ligament, the tendon, actually tendon, not ligament, I'm sorry, tendon. The tendon that go from the muscle, which is quadriceps, to the tibia bone, the calcium deposits itself within the tendon, forming sesamoid bone. And the one example that we need to know here is patella. Some other bones are called the short bones, the tiny bones, like these bones, carpal bones, and also the bones of the tarsal bones. The last type is called irregular. What do you mean irregular? They try to classify. There is no other way for classification. It's not long, it's not short, it's not flat, it's not sesamoid. What else should you call it? Let's just call it irregular. It doesn't look like anything. And the vertebrae is an example of the irregular. So the important part here is examples. Patella, sesamoid. Is the humerus, what type of bone is the humerus? Is it flat? Is it long? Is it short? How about the phalanges? Is it long? Is it short? Is it regular? And so on. So example is important here. The bony markings, this was covered actually when we did the lab. So you can see something like depression, projection, tunnels. If you still remember the very first quiz, when we talked about projection and tuberosity and tuberculoid, and I asked you guys to memorize that, this is what we mean by the bony marking. Each one will have a name, and here it is. So this is more of a lab. It was covered already. Now if we talk a little bit more about the long bones. The long bones will have three parts that we need to know. Diaphysis, epiphysis, and metaphysis. Diaphysis is the shaft. If you look at this bone here, this is which bone is this? Femur, yes. So the main part here, the shaft, is called diaphysis. The heads, or the terminals, the ends, are called epiphysis. What's left here is where those two meet together. And you call it metaphysis. To remember, metaphysis is where they meet. Metaphysis meet. Can you remember it this way? When they meet together. So the meeting of epiphysis with the diaphysis, this point of meeting of those two, this is called metaphysis. Same thing here, where the shaft ends, and which is the diaphysis and the epiphysis start. In between the diaphysis and epiphysis, another metaphysis. So how many diaphyses do we have? One diaphysis. How many metaphyses? How many epiphyses? Okay. The diaphysis is heavy, compact bone. We didn't discuss the bone yet, but remember that this is a compact bone, and we will discuss what compact means. Compact basically means it's compact, it's dense, it's condensed, it's strong. Okay? Diaphysis, on the other hand, is mainly spongy bone. Spongy bone. So the epiphysis, which are the ends like these, spongy bone. And actually, if you focus, look at the wall here, you will see it compact. It's dense. There is no like foramina or something. Versus this, look here, you will see a lot of spaces in here, right? So it looks like a sponge. You know how the sponge looks like, right? It contains a lot of cavities and foramina. So that's why they call it spongy bone. So we have compact bone, spongy bone. The diaphysis is mainly compact bone. The epiphysis is mainly spongy bone, but it's covered by compact bone from outside. Okay? Within the diaphysis, the center part, which is this cavity inside, this is the medullary cavity that contains the bone marrow. Okay? So this bone is the femur, and diaphysis, epiphysis, and metaphysis, and the medullary cavity. Now the structure of the flat bone. So we are discussing more of the histology and structure rather than the names of the bones and the markings on the bones. This is more of lab. From the lecture of physiology, we're talking more about the function and the shape and the histology. So the parietal bone is a sandwich. Parietal bone, for example, of the skull, which is an example of flat bone. So the first example of flat bone is parietal bone. So parietal bone is like a sandwich of spongy bone between two layers of compact bone, like this. I don't know if we have in the lab one of these bones that's broken. I think we do. One of the, you can take a look at it in the lab, but if you look at the section, it looks like this. Okay, a sandwich. This is compact, and this in the middle is spongy bone. Next time you go to the lab tomorrow or something, take a look at it and you will see that. So the inside, it looks like a spongy shape, contain cavities and spaces inside. This is compact and this is compact. So this is the structure of the parietal bone as an example of flat bone. And the layers of spongy bone between the compact bone are called the diploi. So if you look at this picture here, this is like a cut section, and again, I think we have something like that. So this is compact, which is the cortex. This is another compact, which is a cortex. The inside filling, the filling of the sandwich is spongy bone, meaning looks like a sponge, spongy shape, contain cavities, spaces, and so on. And each one of these, look, if you look at these, this is called the diploid. What is the bone itself from the histological point of view? What's the structure of the bone? The bone is collagen fibers and calcium salts. That's the bone. Collagen fibers and calcium. So kind of looks like this. You have collagen fibers like these, collagen fibers, and then you have calcium salt deposited on it, and this is the tissue, the bony tissue. Collagen fibers and calcium salts. What type of calcium salts? We will see. So it is collagen fibers and calcium salts, and there are blood vessels within that. So inside here you will see blood vessels. Okay, collagen fibers, calcium salt deposited on the collagen fibers, and blood vessels, which this is surrounding the blood vessels. The passageway of the blood vessels within the bone is called the canaliculi. Canaliculi. So this is the passageway for the blood vessels. The cover of the bone is called periosteum. Peri means around, osteum means bone. So this is the surrounding of the bone. And it consists of two layers. I think we covered that when we talked about the tissues before. Do you remember which was the outer and which one is the inner, cellular versus fibrous? Is the cellular inner or outer? Inner, and the fibrous is outer. So it's two layers. Same thing like the what? Yes? Chondrium, very close. Chondrium. Perichondrium. Same thing of the cover of the cartilage. The cartilage is covered by a layer that's called the perichondrium. Perichondrium around the cartilage. Periosteum around the bone. Both of them have two layers. Both of them, the inner layer is cellular, the outer layer is fibrous. It's exactly the same. But when we say cellular, what type of cells? That's the difference. The bony matrix itself, which contain the collagen fiber and calcium salts. What kind of calcium salts? Specifically, 2/3 is calcium phosphate. So what type of calcium salt? 2/3 is calcium phosphate. And the calcium phosphate will react with calcium hydroxide to form hydroxyapatite, and you need to remember that. So if I ask you about the calcium salt, there are different types of calcium salts. But what is the major one? Calcium phosphate, specifically. And calcium phosphate will react with another one, which is the calcium hydroxide, to make crystals of hydroxyapatite. Don't worry much about the formula. Just remember, calcium phosphate is the main one. React with calcium hydroxide to make hydroxyapatite, and this is the main structure or the main form of calcium salts. It's calcium salts and ions. And then the collagen fibers is the other third. Okay, so this is the structure of the bone. Now the cells. The cells are only 2%, and you have to know the function of each one of these. Osteocytes, osteoblast, osteoprogenitor, osteoclast. Okay? And the rule is, if you still remember, I told you that you will see that many times. Osteoblast versus osteocyte. Do you still remember? Which one make and which one maintain and modify? Which one make? Blast. And which one maintain and modify? This will apply for everything. If you remember, we talked about this in the fibrous tissue, but it's actually everything. Okay? So osteoblast make the matrix. How about the osteocytes, which is the mature? So the osteoblast is the immature bone cells. The osteocytes are mature bone cells. The immature bone cells, which is the osteoblast, this is what make the bony matrix, the substance of the bone. The osteocytes, which is mature, so it's the same cell, just got maturated. And it will maintain and modify the bony matrix. So we got two so far, right? And it goes without saying. Anytime you see blast or site, you should know. The third type is called osteoprogenitor cells. What's progenitor? Progenitor is exactly like germinative. Do you remember the germinative cells? Stem cells. So osteoprogenitor cells, so each stem cells of each type of cell will have a name. So germinative cells, the germinative cells are the cells that germinate the other types of skin cells. Osteoprogenitor cells are the stem cells that's going to develop and become osteoblast. Okay, so osteoprogenitor cells, these are the stem cells, mesenchymal cells, stem cells, mesenchymal cells, same thing. Okay, so these are going to progenitor, progeneration, generating. Okay, just like the germinative cell, germinate, generate, germinate, it's the same thing. Okay, so osteoprogenitor cells will generate osteoblast. Osteoblast will make the matrix and then change to become osteocytes, and the osteocytes will maintain and modify. So we got three so far, right? The fourth one is not even a bone cell. It's not. So why did you call it osteoclast? Because these are the bone breakers. They break down the bone. It does not belong even to the bone at all. It is developed from the white blood cells. But because it work on the bone, so we give it osteoclast. Osteoclast means the bone breaker. So osteocytes is just the mature bone cells that maintain and modify. That's what I want you to remember. Osteoblast make the bony matrix. Osteocytes modify, maintain. So the osteoblast will divide and become the osteocyte, but the osteocyte will not divide anymore. It will just maintain, modify, repair. Maintain, modify, repair. That's all. Maintain, modify, repair. That's all what we need to know here. And again, this is the case for any site. Maintain, modify, repair. Osteoblast, we talked about this already, but just understand that the osteoid is a matrix that's not classified yet. Not calcified yet. Okay, so the osteoblast make the bony matrix, which is the osteoid. And what's oid means at the end of any word? Are we following? Oid? Yes, somebody said it? Similar to, yes, similar to. So osteoid means similar to bone. What do you mean similar to? Meaning it will become bone. It's similar to the bone, just add some calcium and it will become bone. So the osteoid is the matrix that's produced by the osteoblast and it's not calcified yet. Not calcified yet. Osteoprogenitor cells, we already talked about this. And so it generates and becomes osteoblast. And it will help also in the repair. So when we talk about the repair, this is the second cell, isn't it? Osteocyte help the repair. Osteoprogenitor cells also help the repair. And it's located in the endosteum and the inner layer of the periosteum. This is the location. Okay, what's the endosteum? This is the bone. The outer periosteum, the inner endosteum. So it's surrounded by two layers. One that's surrounding from outside, like this. If this is a cut section, if this is a cut section of a bone, this is the bone itself. This is the periosteum, and this is the endosteum. Okay? Did you get this? So the periosteum is the surrounding from outside. The periosteum is the lining from inside. So where is it? In both of them. not inside. It's in both of them, the inner and the outer. Which part of the outer? It's the cellular layer, not the fibrous, obviously. Osteoclast. These are the bone breakers. These are responsible for osteolysis. Osteolysis. Osteo means bone. Lysis means breakdown. So these are the cells that break down the bone. It's not bone cell. It comes from white blood cells, from macrophage specifically. So these are modified macrophage that's doing the function of lysis of the bone. How can you lyse the bone? What is the bone in the first place? What's the bone substance? It is collagen fiber and calcium salt. How can you dissolve those two? Why do you want to dissolve it in the first place? Why do you want to dissolve it? Because it's more important to have enough calcium in the blood that's serving you in a lot of things, including the nerve impulse, including the muscle contraction, including everything. It's lifesaver. If you don't have enough calcium, you will die. So it's more important to have calcium, normal calcium level in the blood rather than strong bone, right? Would you survive and your bone is a little bit weak, or you have a strong bone and die? Right? So it's more important to have normal calcium level in the blood. This is your goal. This is a calcium homeostasis. Yes, it is important to have calcium in the bone to be strong, but which one is more important? Obviously, the calcium level in the blood is a lot more important, because if it goes down, heart arrest, death. So we have to have it within the limb. So what happens if for some reason, we will discuss that, but what happens if the calcium level in the blood goes down? You cannot afford to wait until you eat and absorb and replace. There is no time for this. It takes you a couple of hours and your heart will stop. So you have to do something. What should you do? You take the calcium from the bone. It's ready there. But the calcium in the bone is not ready to be taken to the blood. Why? Because it's calcium salts mixed with the collagen fiber. It's not ready for use. What should you do now? I need to dissolve this, not the whole bone, of course, a little part of the bone, dissolve it, dissolve the collagen fibers, which is protein, dissolve the calcium salts. Now you have free calcium, simply take it to the blood and you're fine, right? How can you dissolve the protein, and how can you dissolve the calcium salt? The protein is dissolved by proteolytic enzymes. Proteolytic. What's proteolytic? Proteolysis means proteolysis. Protein breakdown. Collagen fibers is protein, right? Collagen fibers are protein. So this is one. Now you still have the calcium salt. You cannot take the calcium salt to the blood. You need calcium. So how can you break it down? There are some enzymes or acids, actually acids, that are produced from the osteoclast to dissolve the calcium salts. Now you have free calcium, take it to the blood, and you're fine. Did you get this? Okay, so this is the function of the osteoclast. Is that something good? Breaking down your bone, is it good? Yes, it is, if needed. Okay, because you will need to break down the bone and take calcium, put it in the blood. How to break down the bone? You have two components, collagen fibers, which is protein, and calcium salt. How to dissolve the collagen fibers? Proteolytic enzymes. How to dissolve the calcium salt? Acids. Where are those two coming from? Osteoclast. So now you have dissolved the bone, or this part of the bone, you have calcium free, just move it to the blood. Okay? So these are the different types of cells, and this is what we need to know here. Homeostasis itself. We normally have a balance between the bone builders and the bone breakers. What are the bone builders? Osteoblasts, not site. Sites are not builders. These are modifiers. They help modification, they help maintaining the bone, and it helps repair, not building. The bone builders are osteoblasts. So, and the bone breakers are osteoclast. Osteoclast. Blast and clast. Blast builders. Clast breakers. And you have a balance between those two. Okay? You're not supposed to give one of them the upper hand unless you have to. Okay? If you give the upper hand to the osteoblast, the bone will become stronger on the expense of the bone in the blood. If you give the upper hand to the osteoclast, the bone will become weaker, but you give the calcium to the blood. So you have to have balance between those, and don't give the upper hand to one of those unless you need to. So under normal circumstances, there is a balance between those two. And if we were saying when to give the upper hand for one of those, here are the two scenarios. If you have low calcium level in the blood, which one should you give the upper hand? Clast or blast? Clast. So you have to, right? At this point you have to. What if you're exercising really hard? You have to have the bone that is stronger, right? You have to. So if in that case, which one you give the upper hand? Blast or clast? Blast. Okay? If you're not exercising, if you don't have a problem, balanced. Right? If we're talking about the compact bone, and we will talk about the spongy bone. The two types are compact and spongy, right? First type is compact. The compact is a group of units. These units are called osteon. So what's the osteon? It's the basic unit of the compact bone. Okay? Osteon is a basic unit of the compact bone. And it looks like if you cut the onion, if you cut the onion into two halves, you see how the laminae, how it is like layer after layer after layer, multiple layers, circular layers, concentric lamellae. This is how the osteon looks like. So these are lamellae, concentric lamellae containing the osteocytes, and there is blood vessels in the middle. So if you look at this, see how it's circular? Concentric lamella after lamella after lamella. And what is in the middle? What is this? The lamella form around blood vessel. Blood vessel. So you have a blood vessel here, lamella, another lamella. Like if you have an onion, the center of the onion is a blood vessel. There are some cavities also. The cavities are called lacunae. And this is just a translation. Lacuna means space. Lacuna means space. Lacunae, if you put E, any word that ends with A, you put an E, you make it plural. A is a single. So lacunae is the plural of lacuna, and what's lacuna is the space that contains the osteocytes. Okay? So the osteoblast go to this lacunae and mature to become osteocytes, and it's called the lacunae. You also have some canaliculi that give route to the branching blood vessels to feed the bone. Here it's how it looks like. Well, this is just another type of microscope. So it's giving you, what is it? What's here? Blood vessel. And what are these spaces? Lacunae. And it contains osteocytes. Osteocytes. Once you have the lacunae, it's osteocytes, not osteoblast anymore. So look at this. This is how it looks like. You have the canal inside that contain blood vessels, capillaries and venules, and then layer after layer after layer after layer. It looks exactly, if you look at one of those, doesn't it look like an onion that you cut it? Cut section of the onion. It looks like this. Okay, and these are the perforating canals. So it goes like this. This is in the middle, as you see here. And you will see branching coming out of it to feed the rest of the bone, the bony tissue. Looks like this. Lamina after lamella after lamella after lamella, and so on. And obviously, the space within the the insides of these compact bone if we're talking about the epiphysis, will have the spongy bone, and the spongy bone does not contain osteons. So again, the osteons are the basic unit of which type of bone? Compact bone, not the spongy bone. Okay. The spongy bone is around something called trabeculae. Okay. So the basic unit of the compact bone is osteons. How about the spongy bone? Trabeculae. And within this spongy bone, because it is spongy, isn't it spongy? Means looks like a sponge, meaning it have a lot of spaces, right? Within these spaces is the red bone marrow, which will make the red blood cells. Okay? Later on in life, as we grow, the fat will start to deposit within the red bone marrow, replacing the red bone marrow, and it change to the yellow bone marrow, which is mainly for storage of lipids. Okay, so this is the function between red and yellow bone marrow. So these are the trabeculae. Here is the spongy bone. Look at it. If you focus here, do you see it looks like a sponge kind of? Right? Inside here. So trabeculae. Your weight, starting from the skull, the weight of the body, starting from the skull, goes down to the vertebral column, from the vertebral column to the pelvic bone, then to the femur. Okay? So the femur is transmitting or transferring the weight from the hip to the knee. It goes like this. So we talked about the periosteum already. And the function of the periosteum, surrounding the bone, isolating the bone, providing a route for circulation and nerve supply, and also it helps in growth and repair. These are the functions of the periosteum: isolation, provide route for circulation, help repair, and bone growth. What exactly help repair? The inner layer that contain osteoprogenitor cells. The inside of the bone, as I mentioned, contain endosteum, and the endosteum is incomplete cellular layer. Okay? Inside of which there is an incomplete cellular layer, and within that, so if you look at it like this, this is the bone, this is periosteum, and this is endosteum. The periosteum is two layers, outer fibrous, inner cellular. The endosteum is cellular, incomplete cellular, and inside which is this. Okay, this is the medulla or the marrow cavity, the medullary cavity or the marrow cavity. And within the endosteum, you have osteoblast, osteoprogenitor, and osteoclast. So all three except the osteocytes. Endosteum also do the same thing at the periosteum, bone growth and repair. Osteogenesis, genesis of bone, generating the bone, and this is the bone formation. Ossification is when you change something from one type of tissue to the other type, which is bone. What are you talking about? Any other tissue. So this is a connective tissue. Okay, are we following? This is a connective tissue. Add calcium salt to it. You're ossifying the connective tissue. Okay? If this is cartilage, put some calcium salt. You're ossifying the cartilage. So ossifying means replacing the tissue with another type of tissue, which is bone in this case. Calcification is adding calcium salt versus ossification. So now ossification. What's ossification again? It's to change the tissue to osseous tissue. What's the osseous tissue? Bony tissue. Okay, and this is what actually occur in our body. This is how we make the bone in the first place. We start with either a membrane or cartilage. This is how we make our bone. You start with a membrane, something like this. This is a membrane. And you start to put calcium salt on the membrane to change this membrane into bone. or you have this cartilage and you start to put calcium salt on the cartilage, change it to bone. So these are the two types of ossification that we have in our body, and this is what's happening in the fetus. The fetus will have membranes and cartilage first, and then he starts to add or deposit calcium salts to change it, to make it bone. The first type is endochondrial, which is you ossify the cartilage. This is how the fetus ossify the cartilage. What type of cartilage? Hyaline cartilage, specifically. Okay? So you have hyaline cartilage, you add calcium salt, you change the cartilage into bone, and you call this process endochondral ossification. Are we following so far? Any question? So we start with hyaline cartilage, and how to change the cartilage into bone. Just general idea about the steps, not all the details. So you start, this is a piece of cartilage, this is a hyaline cartilage. So you start to enlarge the chondrocytes within the calcified bone, okay, and then you start to enlarge more and more, and you have diaphysis, epiphysis on either side. Blood vessels start to invade the cavity of the cartilage now and start to ossify from inside. The blood vessel grow and the cavity enlarge. And then other blood vessels start to invade the epiphysis itself. So now you have the diaphysis, epiphysis, and then the metaphysis is what's left in between those two layers until you actually have the cavity and the spongy bone within the epiphysis, and now you have the actual bone. When you're talking about the growth, how the bone grow, this is one type of growth that's called appositional growth. Appositional growth is when the compact bone become thicker and stronger. The compact bone of the long bone will become thicker and stronger. This is called appositional growth. Now what's the epiphyseal line? Epiphyseal line versus epiphyseal cartilage. If this is a long bone, what is this? Which is diaphysis, and what is this? Epiphysis, and this is another epiphysis, and what's this area? Same thing here, right? So at this point, we leave a cartilage at the metaphysis, very close to the epiphysis. There is a cartilage here that's called epiphyseal cartilage. Epiphyseal cartilage. The epiphyseal cartilage is what is responsible for this bone to become longer and longer and longer. So this is obviously active during childhood, before puberty, right? Do we become any taller than this? No, we stop at certain age, right? So from delivery, from the time of delivery until the bone stop growing, it starts like this and become grow, become longer and longer and longer. Epiphyseal cartilage is responsible for that. So it starts to make bone and become longer, longer, longer. This is epiphyseal plate. After puberty, after we stop, actually not puberty, I think it's 18, but after the time of closure, when the bone will not become, will not grow any longer, the epiphyseal cartilage will disappear. So this epiphyseal cartilage, it will disappear like this, and you end up having just a line like this. It's just a line, and you call this line epiphyseal line. So the cartilage disappear. Once the cartilage disappear, it's gone. You cannot the bone cannot grow any longer. So when the epiphyseal cartilage is replaced by the epiphyseal line, then this is the closure of the bone, and the bone will not grow any longer. How exactly do you make it longer? The osteoclast will start to invade inside and make this marrow cavity larger, and then the osteons are adding. We erode inside and adding, like this. Look at this. If this is a bone and you want it to be like this, how to do it? It's like this. So the osteoclast will start to erode the inside, so the cavity is longer, and you add from outside. Erode from inside by the osteoclast, add outside until you get it like this. Okay? And this is how the bone become mature and enlarge. So if you look at this, you see this black cavity here, like this? Very obvious, right? Basically, the X-ray will, the idea of the X-ray goes to the bone, and if there is calcium, it will reflect back. Okay, if not, it will be absorbed. When it's reflect back, it's white. When it's absorbed, go through, it will be black. So the black is obviously not bone. This is bone. The white is bone. So now, is this growing or not? If you look at this, I'm not going to ask you about this, but just from your understanding, do you think this is still growing or not?
It's still.
Yeah, because of the cartilage. Compare it to this. You see any black? You can barely see a line here. I don't know if you can see it or not, but there is actually a tiny line here. And here, can you see this line here? Very faint. This is the epiphyseal line. Can this grow? No. It's epiphyseal line, not epiphyseal cartilage anymore. The other type is called intramembranous ossification. And by the way, the first type that we just covered, which is the endochondrial, this is the vast majority of the bone. Most of the bone start as cartilage. Some bones start as a membrane or as a dermal undergoing dermal ossification or intramembranous ossification. And the example of that you need to know is the mandible and clavicle. Those are the two bones, the two examples of the bones that start, that grow as intramembranous. So now know that your mandible used to be just a membrane, and then it changed to become bone. Okay, your clavicle used to be a membrane, and then you change it. Most of the other bones are just cartilage, and you changed it. So mesenchymal cells will start to aggregate and become osteoblasts and start the ossification process, changing the membrane start to make the membrane wall bone, and then the blood vessels will start to be trapped inside these layers of osteoblast, and osteocyte will start to grow, and then you start the process of ossification. Spongy bone, you make the spongy bone in the middle, remodeling that, until you end up having the bone replacing the membrane. The blood vessels, if we're talking about the mature bone now, blood vessels of the bone, if you look at this picture here, this is called the metaphyseal artery and vein, this one right here, because it's in the metaphysis. Here is another one, same thing, but there is one in the middle, which is this one here, and this is called the nutrient artery or vein, and it enters the long bone through nutrient foramen. Okay, so what are the types of blood vessels that we have? We have metaphyseal and nutrient. Metaphyseal at the metaphysis, nutrients in the middle of the diaphysis, okay, which is called the nutrient artery and vein. There are also some periosteal like this, periosteal blood vessels that cover the periosteum. What types of blood vessels do we have? Metaphyseal. You have the diaphysis, the nutrient at the middle of the diaphysis, and then periosteal at the periosteum. These are the three types of blood vessels that we need to know. There are also some lymph and nerve supply, and actually the sensory nerve in the bone is heavy, and that's why you feel severe pain if you have any impact to the bone or something, you feel severe injury because severe pain because the periosteum is heavily innervated with sensory nerves. These are the abnormalities. Heterotropic bone formation. When the bone, heterotropic means different location, heterotropic. So the bone is not formed exactly like it should be. Start to grow from this part and avoid this part so it looks like this. This is extremely rare. There is always a remodeling of the bone. So even in adult bone, the maintenance is by remodeling. You always replace. So you take the calcium away and replace it. You can take it away and replace it. This is a remodeling, a recycling of the bone that always occur, recycling and renewing of the bone matrix. And this is with the balance of the different types of bone cells. There's always a turnover. And again, you're supposed to have a balance in the turnover. Okay? A balance between deposition and removal. You add and remove, add, remove. If you add more, the bone will become stronger. If you remove more, the bone will become weaker. And the exercise, obviously, the rule of the thumb. Generally speaking, use it or lose it. Anytime you use any organ, it will grow larger. When you exercise and you use your muscles, muscles will become larger, right? Stronger. When you use your bones, when you exercise, the bone has to become stronger. If you lay down and you're not doing activity, your body will assume that you don't need this organ, and that's why you don't need it. And this will degenerate, and it takes only few weeks. Excuse me. It takes only few weeks to lose about a third of your bone. So you go to the hospital, you're not moving, you stay for 3 weeks, you lose a third of the bone. Third. That's how quick it is, how fast it is. Okay, use it or lose it. Specifically the bone, it degenerates really fast. It takes you only a couple of weeks and you lose 1/3. Okay, so now homeostasis. Homeostasis of the bone, how to keep the bone within the normal shape. To keep the bone within the normal shape, you have to have calcium and phosphate salts. It's not only calcium, it's calcium and phosphate. The main thing is calcium, but you also have to have some phosphate salts and some small amounts of magnesium fluoride, iron, and manganese. And you need to remember that. Okay, so what's the main thing? Calcium salts. It's collagen fiber and calcium salts. That's the main thing. What else beside that? The main thing is phosphate salts and very few amounts or small amounts of magnesium, manganese, fluoride, and iron. And remember that. Calcitriol. Does anybody remember the calcitriol that we talked about before? Calcitriol. This is the active form of. We talked about this yesterday. Anybody remember? Yes. So where do we make vitamin D3? In the skin. Where do we activate vitamin D3 to become calcitriol? Kidney and liver. Okay? So calcitriol is a hormone that used to be vitamin D3. It become active. Kidney is the main thing where we make the calcitriol. And cholecalciferol, I'm sorry, cholecalciferol. So the calcitriol is a hormone that's made by the kidney, and it will help the absorption of calcium and phosphorus. And take it as a rule, always phosphorus follow calcium. Okay? So you absorb calcium, you absorb phosphorus. You don't absorb calcium, you don't absorb phosphorus. And you need both of them. Okay? The main thing is calcium followed by phosphorus. What else do we need to have the healthy bone? So the first thing is minerals. Calcium, phosphate. Calcium, the main thing. Some phosphate or phosphorus, plus small amount of magnesium, manganese, iron, and fluoride. What else do you need? You need vitamin C. Why do we need vitamin C? Not for the calcium. It's for the other part. Collagen fibers. And the collagen fibers start with C. Collagen, C, vitamin C. Okay? Collagen start with C, vitamin C. You need vitamin C for the collagen fibers. You need vitamin A for stimulating the osteoblast. You need vitamin K and B12 to make the protein part of the bone. So this is also needed for the protein part. You need growth hormone and thyroxine to stimulate the bone growth. You need estrogen and androgen to stimulate osteoblast. And that's exactly what explains osteoporosis. What's the osteoporosis? The bone become porous and weak, right? Porous and weak, osteoporosis, due to reduced activity of the osteoblast. Why the activity of the osteoblast is reduced? Because of drop in the estrogen in case of menopause in females. So you don't have enough estrogen. You stop kind of, or you slow down the stimulation of the osteoblast. Androgen is the same thing. That's why we know about menopause in females. What's the equivalent of that? Kind of, not exactly. What's the equivalent in that in males? Does the males have menopause? No? There is actually, but it's not called menopause. We have only two men here. There is something called andropause. Andropause is equivalent to the menopause, but it's a little bit different. The menopause in females is where all the ova are gone. You don't have any follicles anymore. It's all gone, and the estrogen goes down. In males, it's the androgen that goes down. It's called the andropause. And the females will lose their fertility, so we don't have any more follicles, no more pregnancy, but males continue. So what is affected in males? It's the androgen. When the androgen goes down, a lot of vital functions that are linked to the androgen will be affected, including the bone. And that's why older people, even males, have weaker bone. Why? It's not osteoporosis. The effect of estrogen on the bone is kind of similar to the androgen, but the estrogen is a lot more predominant. The estrogen have a huge effect on the osteoblast. Androgen have some effect. So in andropause, when the androgen drops in older people, the stimulation of the osteoblast lower down, decrease, so the bone will become weaker. So actually estrogen is needed, androgen is needed. Calcitonin and parathyroid, these hormones regulate calcium in an opposite way. Which one increase calcium level in the blood? Does anybody know? Parathyroid hormone increase calcium level in the blood. Calcitonin does the opposite. Okay? And I think we will cover the homeostasis of the calcium later on, but for now, remember that the parathyroid hormone and calcitonin are the two opposite hormones that maintain the level of calcium in the blood. Parathyroid hormone is pro-calcium, trying to increase the calcium level in the blood. Calcitonin is the opposite, try to decrease calcium level in the blood. Are we following so far? So if I ask you what's the function of the vitamin C in relation to the bone, collagen. A, osteoblast. Estrogen and androgen stimulate osteoblast. Vitamin K, B12, important for the protein, bone protein. Calcitonin and parathyroid hormone, these are two opposite hormones. They work together in balance. Parathyroid hormone try to increase or decrease. Parathyroid, increase, and calcitonin, decrease. These are all the factors compared. Just comparison between calcitriol, where is it produced from, and what does it do exactly. And just take it as a rule, anything that increase calcium will increase phosphate, anything that decrease calcium will decrease phosphate. Just take it as a rule. Like calcitriol increase calcium absorption, it will increase phosphorus absorption as well. Growth hormone stimulate osteoblast and the senses of the bone matrix. So growth hormone will make your whole body grow, right? Growth hormone, the hormone of growth. What is it responsible for? Growth. Growth of what? Everything. Okay, so how about the bone? It will stimulate both calcium deposition and protein synthesis. Thyroxine in general will help the same function of the growth hormone. Thyroxine will help growth hormone. And that's why people having hypothyroidism, they are shorter for this reason. Because the thyroxine that's produced from the thyroid gland will work with growth hormone to stimulate the growth of the bone from the two aspects, the protein part and the calcium part. Sex hormones, we talked about this, parathyroid hormone versus calcitonin. Parathyroid hormone, where is it produced from? What's the name of the gland? It's the same name. Parathyroid gland. Parathyroid hormone, parathyroid gland. How about the calcitonin? Thyroid gland. Are we following? The thyroid gland is this gland here. Okay? The parathyroid is a tiny gland in the back. This is another gland. So the parathyroid hormone is secreted from parathyroid gland. Calcitonin is secreted from thyroid gland. But thyroid gland is supposed to secrete thyroid hormones, isn't it? Yes, this is another cell. It's called type C. Calcitonin, C cells. So C cells of the thyroid gland. Okay? So let me ask you this. Imagine that you are calcitonin. Think about it. You are calcitonin. What is your effect on the bone? Do you take calcium from the bone to the blood or from the blood to the bone? Bone to the blood, that will increase calcium level in the blood. Is that the function of a calcitonin? It's the opposite. So what would you do? You take the calcium from?
The bone. The
blood to the bone. What is your effect on the osteoblast and osteoclast? Which one you activate and which one you suppress? Think about it. You are calcitonin. Your goal is to decrease calcium level in the blood. What would you do?
So you're activating the osteocytes?
Osteoblast.
Blast.
Yes.
And then
So you activate osteoblast. What osteoblast will do? It will take the calcium from the blood, lay it down in the bone, make the bone stronger, but decrease the level of calcium in the blood. What do you suppress? Osteoclast. Are we following? Osteoblast and osteoclast. Osteoblasts are the bone builders. They take calcium, put it in the bone. Osteoclast, the bone breakers. Break down the bone, take the calcium to the blood. Are we following so far? You are in balance between those two. If you are calcitonin, which one you give the upper hand? Osteoblast or osteoclast? Think about it. Let's say anything. Osteoblast. Osteoblast, they will take the calcium from the blood, lay it down in the bone. Is that what you're doing as calcitonin? Yes. Okay, how about the parathyroid hormone? What's the goal of the parathyroid hormone regarding calcium in the blood?
to increase it.
Increase calcium level in the blood. How? Do you stimulate osteoclast or osteoblast? Think about it. Think about the two scenarios. You parathyroid hormone, you stimulate osteoblast. Okay, think about it. That's okay. You stimulate osteoblast. What osteoblast will do? Is it a bone builder or breaker? Builder. So it will take calcium from the bone to the blood. That will make it weaker.
So it's osteoclast.
It's the osteoclast. What's the function of the osteoclast? Breaking down the bone. Take the calcium from the bone to the blood. Are you following what I mean by this? So imagine these scenarios and get yourself familiar and just think about the two scenarios. Is it osteoblast or osteoclast? I don't know. Okay, let's say osteoblast. Osteoblast builders. So it will take the calcium and build the bone using the calcium. So the calcium level decrease. Okay? Imagine it's osteoclast. It's the opposite. So if you are calcitonin, you want it to decrease the calcium level in the blood by activating osteoblast. Does it make sense? Instead of just, you can memorize it if you want to, but just think about it. That's better. Calcitonin, decrease calcium level. How? Activating osteoblasts and inhibiting osteoclast. If you are parathyroid, what I'm trying to do, I'm trying to increase calcium level in the blood. How? You activate osteoclast. Osteoclast break down the bone, give you the calcium that you use to increase the calcium level in the blood. Make sense? Otherwise, you wanted to memorize it, that's fine, but it's better to understand.
So it's all about the calcium in the blood.
Yes.
It goes up and down.
Yes, exactly. So parathyroid, this is the most important thing to remember. Parathyroid hormone try to increase calcium level in the blood. Calcitonin try to decrease calcium level in the blood. How to increase it or decrease it? By playing with the balance between the two components. Osteoblast, bone builders, osteoclast, bone breakers. Are we following so far? Okay, so we already talked about the effect of all these hormones and enzymes on the bone. There are some abnormalities. If growth hormone, we talked about growth hormone, look at it here again, stimulate osteoblasts and stimulate the synthesis of the bone matrix. So what is the general effect of the growth hormone? Does it make the bone grow or not?
No.
Growth hormone.
Oh, yeah.
Growth hormone, it make the bone grow. It make the whole body grow, including the bone, right? So during development, you need enough amount, just enough, of growth hormone for your body to grow within the normal rate, right? What if you don't have enough growth hormone? You will not grow as fast. You become short. What is this? What do you call this? This is an adult, by the way. It looks like a child, but this is an adult. So what do you call this? Short person? Dwarfism, yes. And what is this? The normal is in between. So what is this? Gigantism. So what's dwarfism and gigantism? Dwarfism is an abnormality of the growth hormone, decreasing the level of growth hormone for some reason. Okay? The opposite is gigantism. But remember something. That's only valid if that happened during growth. What if one of us right here, are you going to be shorter? You think you'll shrink, become shorter? No. So what will happen? Are you going to grow longer? Can you?
Don't women get shorter? Well, I don't know. Don't women get shorter after menopause?
Shorter is something purely physical reason. It's just not women. It's anybody.
Oh, okay.
It's because of the compression of the bone. So this is something completely physical. It's not growing or becoming longer or shorter. This is not the case. Just because the bend and the compression of the vertebrae. So yes, everybody will become shorter like after 60s or 70s maybe. You become shorter. Not because of actual shortening. No, just compression and people start to bend like this. So it appears to you like they are becoming shorter. But does this have anything to do with the actual growth of the bone? No. Okay? So this is a baby who's having normal amount of growth hormone. The growth hormone stimulates the bone and he become taller. The bone become longer. Okay? If you don't have enough, you become shorter as you grow, right? If you have more, you grow faster. But this is only if you're growing, right? What if you're already something like this, like one of us? What if somebody's having a tumor in the pituitary gland that's secreting growth hormone, a lot of growth hormone? What will happen? This is a different condition that's called the name skipped my mind. Abraham Lincoln, do you know? Acromegaly. That will cause acromegaly. So what's acromegaly? Acro means extremities. Megaly means large, huge. Do you remember how Abraham Lincoln looks like?
Yeah.
Yeah, he had tumor in the pituitary gland. He secreted a lot of growth hormone. So the growth hormone go to the bone, there is no way that the bone will become longer, right? So, but do you still have some effect even after closure of the epiphyseal cartilage? Yes. What is the effect? Growth hormone has only effect on extremities and something like this. Okay, the bone here, the bone of the nose, the bone of the mandible, you can still stimulate that. Are you becoming taller, longer? No. But you can still have some effect on the extremities, specifically hand and the foot, these bones. So look at the picture of Abraham Lincoln. You will see this is protruding. This is protruding. The forehead is protruding. This bone is protruding more. The mandible is large because these bones only, this is an exception. These bones only can continue to grow if you add more growth hormone, and this is called acromegaly. So do we know the three conditions now? So if you have less than normal growth hormone during childhood, what do you get? Dwarfism. If you have more than normal tumor or something during growth, gigantism. What if you have more growth hormone after? Acromegaly. Acromegaly. Acro means extremities. Megaly means large. So acromegaly is something like this. See this? These fingers? Okay? The fingers can grow longer. Look at this picture here. The fingers. This is the fingers of somebody who's having acromegaly. And the classic example is Abraham Lincoln. He's not getting any taller, but he's actually still grow the extremities and these bones here. The bony projections can still grow. Even if it's not in the slides, I'm telling you about it. So you need to know the three conditions: gigantism versus dwarfism versus acromegaly. Okay, now calcium. We always know that calcium is important for the bone, but it's more important in the membranes, neurons, and muscles. For the muscles to contract, you have to have enough calcium. For the neurons to conduct, and actually we will cover all the details in the next chapters or the next unit, but for now just know that for your neurons to conduct, to work, to do the function, you need calcium. For the muscles to contract, you need calcium. For the membranes to work and maintain the function, you have to have calcium. Any one of those can kill you if it is disrupted. So you have to have enough calcium ions. It's vital for these. Yes, it's important for the bone. It's more important for this. So calcium homeostasis. Your goal is to keep calcium within the normal range, which is about 9 to 11 milligram per deciliter. Okay? So you want it to be like this. Do you want it to be higher or lower or within the range? What's ideal? Do you want the calcium level in the blood to be within the normal, 9 to 11, or above or under? It's always normal. Above, you think it's good, it's not. Under is definitely not. Everything has to be, and this is all about physiology and homeostasis. Homeostasis is to keep everything within normal range, even if you think it's nice. How about a lot of vitamins? Vitamins, that's good, right? Let me get a lot of vitamin C. No, that's not good. That can cause hypervitaminosis. It's bad. Anything outside of the range is bad, above or under. So this is your goal. So think about it this way. Just to understand the calcium homeostasis. You eat calcium. You eat calcium, right? You absorb calcium, goes to the blood, right? You eat food containing calcium. Okay? So the calcium, you absorb calcium, go to the blood. This is one. You can take calcium from the bone to go to the blood, right? This is two. Or you can get rid of calcium through the kidney and go to the urine, right? So two input and one output. This is how you control the calcium level in the blood, through those three. Absorption of calcium, you can get calcium from the bone, and you can excrete it from the kidney. So you have those two input and one output. You play with those three to keep the calcium level within the normal range. Are we following so far? The first thing is parathyroid hormone. If you are parathyroid hormone, how to play with these three? What would you do with the absorption? Increase it or decrease it? Increase the absorption. What would you do with the calcium in the bone? Do you move it to the blood? From the bone to the blood or from the blood to the bone?
Blood to the bone.
Blood? Blood to the bone, that will decrease it.
Oh, to increase it.
You want the parathyroid hormone, does it increase or decrease calcium?
Increase.
In the blood?
Increase.
Increase. Do you increase absorption or decrease it? Increase. Do you increase moving of the calcium from the bone to the blood or the other way around? From the blood to the bone. From the bone to the blood, I'm sorry. Do you increase the calcium excretion in the urine or decrease it?
Increase.
If you increase it, you will lose the calcium and calcium level in the blood goes down. Is that what you want?
No.
No. Okay. That's fine. Just let's think about it together. So what's the function of the parathyroid hormone? This. You just mentioned it. Okay? This is the function of the parathyroid hormone. What's the function of parathyroid hormone? Increasing calcium absorption with the help of vitamin D. Okay? 1. 2. Mobilize calcium from the bone to the blood. 3. Inhibit losing calcium through the kidney. What if you are calcitonin? If you are calcitonin, what would you do with the bone? Do you mobilize calcium from the bone to the blood or from the blood to the bone? Blood to the bone, that's 1. Do you stimulate vitamin D or inhibit vitamin D? Inhibit vitamin D. What would you do with the kidney? Do you stimulate the kidney to lose calcium or inhibit the kidney from losing calcium? Think about it. Don't just answer. Think about it. What's the function of calcitonin? Decrease or increase calcium level in the blood? Decrease. You want it to decrease, right? Do you want to lose it to decrease it? If you lose it, do you decrease it? Yes. So this is a function of calcitonin. Is that clear? Just understand. We can always memorize, but I don't like that. I don't like just memorizing. What's the function of parathyroid hormone? Increase calcium absorption. It increase mobilization. No. I don't like it this way. Just understand. So if you are answering the question, and actually this way it will be stuck with you. It's stuck in your mind, and when you go to AP2, you remember all what I'm talking about. And actually later on, whatever the program you're going to do later, you will understand what I'm talking about. And that's why I do some more effort to think together so it will stay, okay? And that's how I remember it, by the way. I remember it from medical school until now, just because I understand it. It's not just memorization. Understand, okay? So this is a function of parathyroid calcitonin. Do not answer. Yes?
So for the calcitonin, we increase excretion within the
Yes, yeah. Yeah, you work with the 3 parameters, specifically those 2. It's more of this. Because this is more through vitamin D. It's not really direct action. You're working with those 2, okay? So when I ask you, don't answer. Does calcitonin increase excretion of calcium or decrease? Don't answer. Say calcitonin. What's the function of the calcitonin? Decrease calcium. If you lose calcium in the kidney, does that decrease the calcium in the blood? Yes? Okay, so this is the function. This is how we think about it, okay? Don't just guess. So understand now the function of parathyroid versus calcitonin versus vitamin D, right? The 3 factors that maintain calcium homeostasis. Where is it secreted from? We already mentioned that. That's all covered. Parathyroid hormone from the parathyroid gland. Calcitonin from C cells or parafollicular cells of the thyroid gland. C cells, parafollicular cells of the thyroid gland. This is the bone. The main thing is calcium. You have 2/3 are calcium and 1/3 is collagen. And there are some other that we mentioned before. The percentage is not the most important thing. Just understand that the calcium is the main thing, followed by phosphorus and very small amounts of magnesium, manganese, iron, and fluoride. Okay? That's good enough to remember. And here is what we just mentioned. This is a balance between those three. And the normal level of calcium is 9 to 11, September 11. If that will help you to remember. Okay? This is a normal calcium level in the blood. So it's 9 to 11. If it goes under that, which hormone will take the upper hand? If it goes under the normal? Calcitonin or parathyroid? Parathyroid? Can we think together here? Can we discuss this? Calcium level is under normal. It is 8, 7. Which hormone take the upper hand? Parathyroid or calcitonin? Parathyroid. It goes down. What do you want to do? Bring it back up. Which one bring the calcium back up? Parathyroid hormone. What's the function of parathyroid hormone? Increasing calcium level in the blood, right? What if the calcium level is 12? Which hormone take the upper hand? Because it will decrease calcium level in the blood, right? Make sense? Now fractures. When fracture in the bone, when fracture occur in the bone, we start with bleeding first, which is called the fracture hematoma. So the part that was fractured will be filled with blood. That's called the hematoma. And then fibrous tissue network is going to lay down and deposit within this hematoma. And then the cells from the endosteum and periosteum, and we mentioned that before. What are the two cells that help repairing the fracture? Osteocyte and? Yes? Osteoprogenitor cells. Both those cells help. Where these are located? Periosteum and endosteum, right? So the cells from periosteum and endosteum will start to lay down calcium, and then you will have something called callus. And the callus is internal and external callus. So fracture will be repaired by osteoblast. That's going to replace the callus will form first. Do we have? Yes, look at this. Did you ever had fractured bone, or do you know somebody who had fracture before?
Yeah.
Right after fracture, do you see this part is kind of elevated, protruding more? This is called the callus. And it is inside and outside. You feel the outside only. There's another one inside, just similar to that. All right? This is called the callus. So what's happening here is, have fracture. After the fracture, you will form the callus, which is this. This is the external because you can see it from outside. There's another one inside. So this is called the callus. Okay, so the callus is formed, and then the osteoblast is going to replace the cartilage of this callus. Okay, let's do it like this. If you have a fracture of this bone, right? You fracture this bone. Blood is going to form a hematoma here. That's one. Two, fibrous tissue starts to come here. Number three, you form a callus. So callus will be like this. You feel this one outside, right? Because that's easy. Anybody can feel it. You can feel it, right? There is another one that's called the internal callus. So we have outer and inner callus. And there's cartilage in the middle. Osteoblast will start to invade the cartilage here and change it into bone. Okay? And then osteoblast and osteoclast will work together like this. Osteoclast remove bone, and osteoblast deposit bone. Remove bone, deposit bone. Until you go back to the normal bone, not perfectly. Unfortunately, it's never perfect. This callus will never be like straight 100% like this. There is always remnant. It takes years. So you have it like this. This is the outer callus and this is the inner callus. Okay? So start to decrease, decrease, decrease. At the end, almost. If you ever have fracture before, after 5 years, it's not perfect. Still have a little bit. Yes?
I forgot.
Is it related to the fracture?
Yeah, well, I just forgot.
Okay, let me know if you remember your question. So remodeling the callus occur through the work of osteoblast and osteoclast. Osteoclast remove and osteoblast put. Remove, put, until you go almost, not exactly, to normal. So you have bleeding, hematoma first, and then you form the callus that contain cartilage inside, bleeding, cartilage, and then the callus will be replaced by bone, and then modification of the callus occur, and it takes years with the work of osteoblast and osteoclast together to modify the callus until the bone go back to normal, almost. Now fractures. Fractures can be any one of these fractures, and there are a couple of things that we need to know about each one of these types of fractures. Okay? Not all the details, just let's understand from the pictures. Pot fracture. What's the pot fracture? Fracture in the ankle, both bones. That's what we need to know. When I ask you what the pot's fracture is fracture here, close to the ankle, both bones. What are the both bones? Tibia and fibula. Yes, both of them are fractured. So if the tibia and fibula are broken closer to the ankle, that's the pot fracture. Okay, that's one. Comminuted fracture. Comminuted fracture means shattered bones. It's not like this. It's not bone like this and broken. So when you break it down, you have two bones, right? This is not comminuted fracture. Comminuted fracture, you don't have two pieces of bone. You have shattered bone. So it goes like this. So here is a bone that's fractured. Okay? This is just a normal fracture. Okay? Just a fracture. You end up having two pieces of bone, right? Fracture. Comminuted fracture will be like this. Piece here, piece here, piece here. This is called comminuted fractures. So comminuted fracture is when you have shattered bone, several pieces of bone. And what they actually do, this usually need surgery. It's not a cast. You don't only do cast. The cast is just in the normal fracture. For this part, if the bone particles are too tiny, they remove it and get rid of it. If it is large, they put it back, depending on the situation. But this is not, yes?
So basically you're saying this, if you fracture a bone, it's going to fix itself, but it's never actually going to be the same?
Yes, it's very close. You can say it's 95% or something, which is very good. It's not 100%. This is what I mean. Not 100%. But it's not like weaker or something like that. It is strong, very close to the original, not 100%. So what's the pot fracture again? Pot fracture is broken, both bones close to the ankle. One. Comminuted fracture is where you have something like the femur here, you have shattered bones. Transverse fracture, like this bone, when the bone is broken at the shaft, just like this. Just like this. This is transverse fracture. Just the bone is fractured transversely, like this. Okay, you have, this is a bone, this is transverse fracture. Okay, so you have the two pieces along the axis, and this is the transverse fracture. The next fracture is spiral fracture. And spiral fracture is basically if somebody twists your hand. If I hold your hand like this and twist it, it's not going to be broken down into two pieces like this. It looks like a spiral shape. Imagine if I'm holding a cucumber like this, okay? And you twist it. Is it going to be broken down into two pieces? Or it will make like a spiral shape, right? Do you get what I mean? If you do it like this, it will be twisted and it goes in a spiral shape. So this is the spiral fracture.
What about double jointed?
The what?
If people are double jointed, what is that, like vents in the bone or something?
What's the double jointed?
Yeah, like, you see when somebody's flexible because they're double jointed, how come they don't get hurt when they do certain things?
I'm not sure about the double jointed. What do you mean by that? I'm not sure about
Like-
this.
Like, just being flexible.
The over flexible joints?
Yeah.
Yeah, you're talking about the joints, not the bone.
Oh.
Okay, so in the joints, the leg, and some people have very flexible ligaments, and the ligaments keep the bone within the range. So if the ligaments are very flexible, they can bend more, and the ligaments is okay with that because it's stretchable more, and this is how it goes. A spiral fracture is when you twist something. If I do something like this, okay, and then I move like this. Or somebody holds your hand like this and twist it really strong, the humerus will not be broken into two pieces. It will go like a spiral shape. Displaced fracture is just a fracture that is displaced. So if this is the normal fracture, look at this. This is the bone. This is transverse fracture, okay? Displaced fracture is like this, okay? It's displaced. If that's the case, they have to do traction. This is what they do. Pull, fracture, you pull, align, put it back, cast. Okay? When I was in the hospital, we used to use something, it's not anymore, but we used to put the patient like this, okay? We wrap something like this and put weight, some sort of weight to pull it, and then put it back like this and leave the weight. Now they have machines to use, but that was back then when I was in the medical school. It's called a traction, the traditional way. We tracked because it's like this. Can't leave it. If you leave it, it will stay like this. And one leg will become shorter. So you have to pull. We add a weight to stay it pulled down like this. You realign back, cast, leave it like this until it heals down. Okay, so this is, yes?
So how do broken bones, like spiral fractures, like how do they get back together?
They just realign it back. Okay, if it just twisted, so there is a very minimal space in between the ends of the two bones. Just leave it as it is. There is an emergency X-ray. You have to do an X-ray right away. So see how it looks like this. If it is something like this, they will tract and put it back. Depending on is it aligned or not. If it is aligned, just put a cast. If it is not, they have to pull it and put it back in place, and it will rejoin.
So casts help the bone all that.
Cast has to be done anyway. Any fracture need a cast because you cannot move the bone. You have to leave it as it is because the cells will start to move and fill the space, and then you move it. The cells start again, and then you move it. You have to use a cast anyway. Any fracture need a cast. But displaced is when it's not aligned anymore. So this is transverse fracture. If it goes like this is displaced fracture. Coolest fracture, on the other hand, is the distal portion of the radius specifically. This is called the coolest fracture. And this results from reaching out like this. If you're going to fall down, okay, and I go like this. Okay? So the radius will be broken. Not the ulna, because the ulna is not bearing the weight. It's not transmitting the weight. So if you go like this and you're starting to fall down, you go like this. Okay? This will cause coolest fracture. So what's a coolest fracture? Break of the distal portion of the radius because you're reaching. You're falling down and reaching. Green stick, from the name. Who will have a bone that is like a green stick? Green stick, like a green stick from the tree. Obviously, these are the children, right? The bone of the children is like a green stick. So what's the green stick fracture? It's a fracture of the shaft in children. And this is where green stick came from. Who have green stick? Green stick. Do we have green stick or bone like a green stick? No, it's a solid bone. Who have the green stick, the bone that's like a green stick? This is the children. So what's happening here is the shaft is broken, one part is broken, and the other one just bending. If you ever like to go to you have tree or something in the backyard, you hold one of these green sticks and bend it like this, it will not be completely broken, right? If it's a dry piece of wood, You do this, you break it down. If it is green, just try to bend it like this. Just a little piece will break down. Look at this. This part is broken down and the rest is just bending. Try it if you have a backyard. Just bend it like this. It will not break down into two pieces. Just part will break down and the other part will bend. And this is called the green stick fracture. Epiphyseal fracture is fracture at the epiphyseal cartilage. And the problem with that is, what's the epiphyseal cartilage doing? What's the function of epiphyseal cartilage? Here. What does it do? Help the bone to grow longer? Yes. What if you specifically had a fracture at this point? They will separate, the head and the body and the diaphysis will separate? Yes, but what are the consequences of that? Does this person grow any longer? Stop growing. You destroyed the cartilage. And this is where you see somebody limping like this. Okay? Some people will be limping. Why? Because this bone will continue to grow. This bone will stop growing. So one limb will be shorter than the other, and they start to go limping like this. Most likely, they are unfortunate enough to break down. Any other part is fine, except this one. This is what will help you to grow longer. So if they have specifically in the epiphyseal cartilage, they will not grow longer in this one limb only. The other one will continue to grow, and they will have unequal limbs. The last one here is the compression fracture. And the compression fracture is if you're like falling down, okay, from the second floor or the third floor, something, you have fire in your house, okay, and you're trying to fall down. By the way, what's the best way to, if you have to? What do you think the best way to fall down? Do you fall down like this, your buttocks like this, or straight? What's the best way?
When you fall, like on your arms and legs and bowl.
No, the best way is, if you have to, that you fall down like this and you bend. Okay? You go like this, and once you touch, bend. So your knees, the joints, will absorb most of the shock. Okay? You will have injuries anyway. But instead of having compression fracture, that you're compressing your vertebrae, the worst of all is if you lay down sitting down like this. Okay? This is the worst of all. Definitely compression fracture. And it will be in multiple spots. This is the worst thing. That you lay down on your buttocks, sitting down, and you lay down and you fall like this. This is the horrible one. It can easily injure the spinal cord. The next, which is also bad, that you fall down like this, straight. The best, and the best doesn't mean no injuries, but the least injuries is when you go down like this, straight, and then once you touch, bend. This will absorb like 50-70% of the shock, and the rest will do some injury, but this is the minimum one. But this, if you fall down seating like this will cause compression fracture. Okay? Osteopenia. What's osteo means? Bone. Penia. Weak. Osteopenia, weak bone. Okay? So osteopenia is a normal process between the age of 30 and 40, and women in general will lose 8% of the bone mass per decade every 10 years between 30 and 40, but the men will only lose 3%, and that's why older females, older ladies, will have weaker bone than the male in the same age. If you are 50 and I'm 50, my bone is stronger because 3 versus 8%. Osteoporosis, this is the porous bone, and it actually, as I mentioned, it can occur in males and female, both of them. Okay, and what's the main thing here is? What is lost here? Estrogen. And this is the osteoporosis. Look how the bone is porous. Look. See all these pores versus this? This is healthy bone. This is the porous bone, osteoporosis. And with aging, everything deteriorates. Cancer is more. Osteoclasts become more active in this case, and the bone will become weaker, and it will break down. And this is for chapter 6.